responsibilities?
I am the Chief Executive Officer of the Matagorda County Hospital District, which is comprised of Matagorda Regional Medical Center, which is a hospital for this community that's just been open a little over a year. We also operate a clinic in the community for medical assistance program patients, as well as some of the public health responsibilities for the state. We operate the WIC program, which is for women, infants, and children, to help low income with their needs. And we also operate outpatient rehabilitation. So we've got several sites around the community that are part of the hospital district system.
And what are the challenges you're facing right now?
Well, the challenges today in healthcare are many, but I think from the hospital perspective and from that direction, of course, we're looking at the changes that are promised out of Washington and how that's going to actually affect hospital operations, and trying to understand what the changes, primarily in reimbursement and how we get paid for what we do, are going to affect us, because there's a lot of discussion in Washington back and forth about whether reform is going to stay in the current package that we see now. But what doesn't get talked about very much is just one layer underneath all of that discussion is some promised changes in how we get paid. And so we're trying to really pay attention to those rules and regulations and get prepared for that going forward.
If you could imagine a year from now, and you're partnering with East Texas AHEC and also this Coastal Health Connection to meet these challenges, and that the partnerships are working really well, what would it look like to you?
Well, what's exciting for me about these things starting to come together in our community is that it's going to take every corner of the community coming together to really make it happen, because there's not enough resources in any individual pocket to reach out and meet the needs, and focused on healthcare needs now of our community. There's not enough providers, there's not enough resources for people to try to do this in silos and individual pockets. So we're excited to be partnering with others in the community that have similar goals. I see a year from now, as that's all working well, that we have a table where we come together as a community periodically and check and see the progress that we're making. That we're coming a year from now and we're looking at health statistics that have been published nationally, and we're looking at improvements in those, and that we're able to trace specific actions that have happened in the community and specific collaborations and partnerships that have happened in the community that have had a direct positive impact on some of those health statistics. I see a community that's starting to be more optimistic and hopeful about its future, because we're focused on healthy and the economy's growing, and I believe all those things can happen with a partnership.
And what will this do for you personally? Well,
for me personally, it actually extends my ability to get my mission done for the hospital district. We take on a broad role as a hospital district in this community, and we carry a large responsibility for access to health care, for improving people's lives. And what I am convinced of personally is that we can't do it alone. And so these partnerships, these collaborations help me be successful in my job.